Okay, great. All right, so everyone should have recording privileges now. Great, thank you. Good morning, everyone. I'm Cassie Sauer, and I'm the CEO of the Washington State Hospital Association. Thank you for joining our somewhat regular press briefing. We've made the cadence a little different, but hope that it's still useful to you all. Today, we've got three great panelists from around the state. We have Dr. Mary Fairchalk, who is a pediatric infectious disease specialist for the MultiCare Health System. And MultiCare, as you all know, has Mary Bridge Hospital, which is a pediatric hospital. Brian, I just admitted a couple of people out of the waiting room. So if you could give them recording privileges, please, that'd be great. We have Tracy Kasnick, who's the Chief Nursing Officer at Confluence Health in Wenatchee. We've had Tracy on before. Thank you so much, Tracy, for coming back. We have Dr. Michael Anderson, who's the Chief Medical Officer for Virginia Mason Franciscan Health, which consists of the Virginia Mason Hospital in Seattle and the CHI Franciscan Health Hospitals in the Pierce County and beyond area. Those two hospitals have come together. So thank you to Dr. Fairchalk, Tracy, and Dr. Anderson for joining us today. Really appreciate it. I'll start with some opening comments about what we're seeing right now. We are still seeing folks hospitalized in our state. The data was just still being refreshed this morning, but it looks like it's around 300. Monday morning is not always the greatest time to get data because a lot of times the data comes in the afternoon from over the weekend, but in that range, it looks like people are hospitalized in our state. We also are still seeing deaths in our state from COVID. And I want to be clear that those folks who we are seeing who are hospitalized and dying are people who are not vaccinated. And that I think is very challenging for our healthcare workers to take care of people who are so sick, who could have gotten a vaccine. And I think it's really important to say vaccines are widely available now. We continue to encourage people to get them. But one thing that we are hearing from our member hospitals is that the families who are losing people who are dying, and it's a small number, but still, if we've got 5 or so people dying a day, it looks like across the country there's in the 300, 400, 500 range a day dying across the country. That they're reporting a different level of grief and because they feel like the rest of the world is sort of moving on, and their pain is beginning. And that they also feel that they are not receiving the empathy from their family members or their communities that that other folks received earlier in the pandemic when there wasn't protection. And so there's a lot of people have been describing it to us as a very lonely level of grief. And so we continue to really want people to get vaccinated, to emphasize that this disease is still certainly a much, much smaller number, but it's still making people sick and dying. And if it's your loved one who is the dying person, the tragedy is still incredibly deep. So really hope that people will go out and get a vaccine. I also want to point out that the state is going to be reopening soon. The mask mandate remains in healthcare settings, and that is a mandate out of both the Centers for Disease Control and the State Department of Health. It is a mandate that applies to staff, patients, and visitors. And we are having increasing concerns about, it seems to be especially visitors who are getting angry when they come to the hospital and being asked to wear a mask. Hospitals are full of people who are vulnerable. So they are full of newborn, babies in the neonatal intensive care unit. They're full of people getting bone marrow transplants, who are immunocompromised in very serious ways. And so it is incumbent upon us to be the most careful we possibly can be, which includes requiring visitors, even those who are fully vaccinated, to continue to wear a mask. So we know this has led to even violence in some other settings. We haven't had that report in Washington State yet, but we've heard of a lot of kind of angry, heated conversations. So any reporting that you all can do to emphasize that masks are still required in all healthcare settings, and that it's for the protection of those who are being cared for in that healthcare setting, we would really appreciate that message gets out. I think it gets lost in the masks aren't required anymore if you're fully vaccinated larger message. So with that, I think I will turn over to our panel. And I know Tracy has to leave at 11:30, right, Tracy? Is that correct? Yeah, I can hear you. So why don't we start with you, Tracy, and then we can, if there folks, we'll pause after you speak and see if there's any questions, and then we can go to Dr. Anderson, Dr. Fairchalk, and then hopefully the questions, we'll have time for you at the end as well. But go ahead, Tracy.
Thank you, Cassie. Yes, I'm glad that you mentioned that we're entering a different phase of the moral distress. We're seeing folks who could have been vaccinated but chose not to and are now hospitalized and are acutely ill, and the staff are feeling just a certain amount of futility. And it's a different type of moral distress that they felt earlier in the pandemic. This moral distress and psychological trauma that folks have felt all the way through from the beginning, that has crescendoed, I think, 3 times through the different surges, has really contributed to the staffing shortages that existed prior to the pandemic. The pandemic has definitely impacted that. We're seeing tremendous staffing shortages, just like I think everybody is seeing on the west side. At this point, Confluence Health has 132 nurse vacancies. That is well over about 20% of our nursing positions at this point. It's even getting difficult to get travelers right now. At the height of the pandemic in November going into January, during that last surge, we were really very much struggling and having travelers that we were paying about $150 an hour for, and we lost a significant amount of staff who went off to be travelers, which I could not blame them. We had reports that people could make up to about $10,000 a week. So we had people who were able to make a down payment for a house, and we wish them well, but it definitely contributed to what our overall staffing shortages. We're having staffing shortages in our professional staff. We're having staffing shortages with CNAs, MAs. It's across the board, and we're somewhat scrambling with staff overall. This has been compounded with our cost of living here. The median home price is now about $430,000 for a home in north central Washington. So for folks that are not the entry-level folks, it's a challenge for them to get an entry-level job and be able to afford to live in our area. The nurses that left, they went to the hardest hit areas. We heard that many went to California and Texas and Arizona, and we haven't had many who have come back to us. So that's our position here. I don't think that we're much different in north central Washington. We serve a 4-county area. That's Chelan and Douglas, Okanogan, and Grant County. It's about 235,000 square miles, a lot more jackrabbits than people, but still a lot of responsibility and a lot of care that we need to provide.
Tracy, when you had nurses, I know we've talked in this call before about our desire for the state to join the Interstate Nurse Compact, that we see that nurses are able to move among states much more readily than they are in Washington State. Do you find that with the staff that you're either losing or trying to recruit, that because we're not a compact state, that's a real barrier for us?
It is. It's a significant barrier. We really struggled getting people licensed for our nurses. We were not able to get them licensed because of the emergency. We were able to do emergency licensing, but we couldn't even get people at the Nursing Commission to actually answer the phone. That's how busy they were trying to get people licensed. And had we been able to hire nurses under the compact, it would have been a much, much smoother process. And I think that we had a mechanism that would have, I think we could have met everybody's needs with what was proposed in the legislature. And I'm saddened that that did not work out.
Thank you. And so just to remind folks, the Interstate Compact is a way, if you're licensed in one of more than 30 states, you can go work in one of the other 30 states without having to go through the relicensing process. So for us, the fact that even when the state is expediting the licensing process, which it has done during COVID, it's still a process. And if nurses have multiple offers, and if they have an offer of a place they can go start working tomorrow versus they're going to have to go through a process, even if abbreviated, it dissuades them from coming here. So if anybody wants to talk more about that, we'd love to have more coverage of that issue, because it's a real detractor for our state. Dr. Fairchalk, I'm going to turn over to you for opening comments.
Good morning. So I'm thinking that maybe I could provide some context or information about vaccination and some of the issues that have come up as barriers to vaccination. So, one of the most recent things, of course, people have been hearing about is the concern for myocarditis occurring after particularly the mRNA vaccines, although Johnson & Johnson has been implicated as well, and that raising hesitancy in our already, in many ways, hesitant population. So just to share some information on that, the CDC, I believe, was going to meet about that on Friday, but because of the new federal holiday, I think it's been deferred until next week. But there does appear to be a signal for an increased rate of the myocarditis following vaccination, particularly in young males, 18 to 30 years of age or so. We actually have one of, I think, the first cases that was reported at Mary Bridge that I actually personally took care of, a kid who was, he was about 17 and had received a second vaccination and experienced myocarditis within 3 days after the vaccine. At the time, the only reports out there were really, the U.S. military was looking at it and Israel was looking at it. So we reported it through VAERS as well as another system through the CDC. I think what's helpful for the vaccine hesitant population that I try to do is, there are the like true believer anti-vaxxers that you're not going to be able to convince that any vaccine is safe. But I believe there's, and studies have shown, huge majority in the middle who are vaccine hesitant, who are heavily influenced by things that they might see on social media, very convincing misinformation that is abundant. And so I think that this is actually an opportunity to show that this is how the system works, to ensure that the vaccine is monitored and is the costs and benefits are weighed, because this particular side effect has been recognized as being looked at. It does look like to be an increased signal. So some specifics with that are, for example, in the 18 to 24-year-old population, so far they've had 196 reports out of 9.8 million doses in the US, and they would expect to see something around 8 to 83. So that does appear to be an increased signal. In the 16 to 17-year-olds, again, 79 out of 2.3 million doses, and they would expect 2 to 19. So it does appear to be real. There's a biological plausibility to it. But I think the encouraging message here is that our system is working to show us that this is an unanticipated side effect, which is very rare, which is not seen in the pre-EUA trials, and that it appears to be mild. The vast majority resolve quickly, do not appear to have any long-lasting inflammation to the heart. The few cases we've had, about 3 so far, have all resolved very quickly. So it's to me encouraging. This is an example of how the system should work. So I just wanted to share that, as I know that's been a concern. The other piece of vaccination that I wanted to share, which is the question about, well, why should I get vaccinated if I've been already infected? Aren't I immune enough, that I don't need a vaccine. So there are studies that are going on looking at that, and one that's just out now in a preprint from Oxford is called the PITCH study. And so they have had a prospective study that is looking at PITCH stands for protective immunity from T cells to COVID-19 in healthcare workers. And so they followed 78 healthcare providers who either had symptomatic or asymptomatic infection, and also as a comparison had 8 patients who had severe disease. And what they did is on a monthly basis, they drew blood on these individuals to look at immune memory and to try to get a feel for how long immunity lasts. And so far what they found is it's highly variable. Prior infection does not necessarily provide long-term immunity, especially against the variants of concern that we're starting to see. They did find that immune characteristics at a month post-infection were pretty predictive of whether or not you have a durable response at 6 months, and that symptomatic disease does not necessarily imply protection that is long-lasting, but asymptomatic disease does appear to definitely provide lower levels of protection or durability of protection. And just to conclude with an anecdote along those lines that kind of illustrates this is just last week, I admitted a young lady, 17 years old, who had MISC, the inflammatory condition that's seen sometimes in children post-COVID. And her story was really interesting to me because her mom actually works in public health. And early on in the pandemic, she's a nurse. She was involved in doing a lot of swabbing of COVID patients. And she came down with coronavirus last March, so March of 2020. And the entire family of 4 became infected. This girl had a fairly mild infection. Her younger sister also had a fairly mild infection. The mom was not hospitalized, but very ill and now has pulmonary fibrosis and scarring. And the dad had a pretty mild infection. This 17-year-old then had symptoms that are very consistent with long haulers, which we're still learning about in children. So she had a period of about 6 months post-infection where she had brain fog, fatigue, shortness of breath, dizziness, which is just finally started to resolve. And then in May, became infected again, documented positive PCR, had a more serious infection that time. And then in the family, the mother had been immunized and she did not get infected. The father had not yet been immunized. He got reinfected as well as this daughter, and had a much more significant illness than the first time around. And then lo and behold, the 17-year-old unfortunately then also got MISC. So just within that family, I thought it was a good illustration of the need for vaccine, even in people who have been infected in the past. So that's all I have to.
Thank you, Dr. Fairchalk. And I'll just share an anecdote as well that I have 2 children in the, I have 3 kids, 2 of whom are eligible right now for the vaccine, newly eligible. And I got their first shot and then started hearing about myocarditis and I was concerned about it. And I had an interesting call with all the chief medical officers and heads of pediatrics and the state epidemiologists about this. And one of a topic of conversation was, what is everyone doing about their own children? And there was universal agreement among that group that everyone was having their own children have their second shot, including mine. My 13 and 15-year-olds have now gotten their second, boys, so they both gotten their second shot. But the consensus among these folks who are spending all their time thinking about COVID, not all the time, but a lot of time spending out COVID, was that the risks of COVID are so far greater than myocarditis. And so the definite prudent parent thing to do was to get your kids fully immunized. There's a question for Tracy that, Dr. Anderson, before we turn to you, if it's okay, I'd like to ask Tracy, because Tracy has to leave shortly, and then we'll come back to you. Is that all right with you, Dr. Anderson? Okay. All right. So Tracy, what impact did the staffing shortages you described have on elective procedures and other types of care?
We're looking at all our elective procedures really carefully and not adding on. So we are curtailing what we can curtail, but this is what is elective and what is non-elective is somewhat of a gray area. And we believe that our overwhelmed hospital, and definitely many of the hospitals now are overwhelmed with non-COVID patients, is a result of folks putting off care during our pandemic earlier on. So we're running through We're looking at things carefully. We're putting off what we can, but we're paying a lot of overtime getting done what we really should be getting done so that we're not ending up in a worse situation down the road.
Thanks, Tracy. So just to remind people, the state did require a halt of non-urgent procedures, and there was kind of a shifting definition of what that meant over time. I think people imagine that all that means is facelifts, but it also means that's not correct in a hospital setting. It can mean knee replacement. It can even mean removal of a cancerous tumor. It could be placing of a chemotherapy port. It can be a bunch of things that can lead to more challenging healthcare issues down the line, and certainly a lot of cancer screenings or other kinds of screenings that need to happen in the hospital. Dr. Anderson, love to hear your opening comments.
So thank you, Cassie, and certainly for physicians that are not necessarily epidemiologists, the pandemic has provided an opportunity to learn so much about population health, and following the data that the Department of Health in Washington State has provided to us has been extremely helpful and very interesting in following everything from the presence of variants to vaccination rates and hospitalizations and deaths. But I'll tell you, from the perspective of a physician that has direct sight of 8 hospitals within the Puget Sound area, I'll say our data is really revealing to me. And as already pointed out by Cassie and some of the other speakers, some of the data is very disheartening when you get down to the specific cases of individuals and how those families are impacted. I will say that since the pandemic started here in the Pacific Northwest that we know of, since around the end of February, beginning of March of 2020, Virginia Mason Franciscan Health has clearly seen 4 separate surges of increased hospitalization due to the COVID-19 virus. The first surge, like I mentioned, started in March and was somewhat of a rapid rise and certainly created fear as we learned more about the virus, but then came back down into somewhat of a summer lull with the second surge during the summer. The third surge during the winter time certainly was most fearful for all of us because we saw in our 8 hospital system our number of hospitalizations at any one time surge up to 180 patients in the hospital. But that too subsided at the end of winter, and we thought, okay, this is the beginning of the end as we started seeing some vaccination effect, perhaps. But that took us into another surge that started again in around March timeframe. And it, in my opinion, very closely mirrored that first surge that we saw in the year previous to that. I'll have to say that the peak of that surge was about 15% lower than what we saw in March, and I attribute that to the effect of the vaccine amongst the population. But remember, we still had not achieved anything close to the 70 to 80% herd immunity that will truly protect all of us if we were to achieve that. So where are we now? Well, throughout the last year, the one statistic that I think is most meaningful to me is that we have really not gone below having at least 40 patients within our system hospitalized with COVID-19. Okay? That seems to be the floor that we just cannot get through. Even though we hear about number of cases across the country going down significantly, and we see reports about states removing their mask mandates, I'll have to say my real life experience is seeing 40 patients or more within our system, and it continues. So that tells me that the virus is still in the community. It's still being spread, and as we introduce the Delta variant into the community, I know that it's spreading faster, and certainly the patients that we're seeing being hospitalized are much younger because our over 65-year-old population took heed and they got vaccinated. So we're not seeing those individuals in hospitalization, but we're seeing the younger population, and they are just as sick as those that we focused on that had comorbidities early along in the pandemic. I'm going to have to point out and reinforce what Cassie said. The folks that are in our hospitals now they are unvaccinated. It's rare for us to see a vaccine breakthrough for someone being hospitalized. Because if they do have a breakthrough, the cases are much milder, and certainly the statistics have shown it's protective as far as hospitalization and even death. So it's very frustrating for us as clinicians, as was pointed out earlier along in this briefing, that when we see these patients that are so sick and we know that they had the opportunity to be vaccinated and chose not to be vaccinated for one reason or another, it really does take a greater toll on our staff members as well, not only for the family members. We try not to be judgmental, but I'll tell you, we know that there was a solution to this pandemic, and there are still a significant portion of our population that are purposely choosing not to be vaccinated. And it's a dangerous decision to make. And I think that our healthcare providers have reiterated over and over again, as Cassie mentioned, that really need to become vaccinated. As many have asked us, Virginia Mason Franciscan Health, we are no longer providing our large vaccination sites after providing hundreds of thousands of vaccinations. We've now moved those vaccine opportunities to our outpatient clinics, just as we do with flu vaccine, because there's an abundant number of vaccines available. And indeed, I think in the federal mass vaccination sites, they saw that the number of people coming for vaccination has dropped as well. I'll have to say again that this is a dangerous trend that folks need to understand, that the virus has not departed the Washington state. It's still here, and it's getting meaner with the Delta variant. So hopefully we can stem that tide, and we know that the vaccines have been effective against the Delta variant as well to decrease hospitalizations. As I look into the future, I saw a question on the chat. Are we looking at another surge? I'll have to say, just looking at the pattern that we've seen, there was a prior summer surge last year. I would not put it past this virus to cause another summer surge, not as large as that winter surge that I described, but hopefully we'll have a decrement in the peak of that surge because of the percentage of individuals that have been vaccinated across the state. But the fact that we cannot break that number of 40 patients within our system yet, and it's plateaued since that March surge that I talked about, it just worries me that the virus is going to come back again, and perhaps even in the fall. Therefore, although our mask mandates may be going away, there's really no penalties for wearing a mask, even if you're vaccinated. Certainly, if you're not vaccinated, you're helping to protect others for the potential spread of COVID-19 virus. So with that said, my last words are, if you have not been vaccinated, please reconsider, and for the good of your communities and those that are around you, get vaccinated. Cassie, that's all I have.
Thank you, Dr. Anderson. I think that point you made about it's okay to still wear a mask is really, really worth emphasizing. I am fully vaccinated. I'm still wearing my mask at the grocery store, even after the mask mandate comes off. I feel like it protects me, it protects others. I don't think I would get, I'm quite careful. I don't think I'm going to have COVID, but there are some people are getting it as breakthrough, and I just want to be an extra cautious citizen and not make sure people aren't getting infected. And I think that's actually quite common behavior among infectious disease folks, people who work in hospitals. I think we are public health. I think we're probably the crew that's still wearing masks in indoor spaces pretty regularly. But Tracy and Dr. Fairchalk, are you all both wearing masks still? Yep.
Yes, definitely.
Anybody in this crew. So Dr. Fairchalk, can you talk about the Delta variant? The question is that heard it popping up in younger people, and some where the vaccine might not be 100% protective against it, as well as its symptoms. And what should parents be looking for in this new variant? Maybe Dr. Anderson, you reference it as well. You could talk about the Delta variant as well.
So it's It's definitely more transmissible than the UK variant or the Alpha variant. And in places where it's cropped up, it quickly ends up replacing as being the dominant strain. Right now in Scotland, for example, my sister lives there, it accounts for like 75% of their cases. There's about twice the risk of hospitalization compared to like the Alpha variant. So it does appear to be not only more transmissible, but also more virulent. It is in the United States. You know, we're blessed by having the University of Washington Virology Lab, which is one of the world's best right here in our state. And they've been sequencing virus and gathering a lot of data, not just for our state, but for nationwide. And last I looked on their site, they had sequenced, I think, around 157 Delta strains in Washington state. So it's definitely here. I mean, there's no reason to think it won't become the dominant strain here. Regarding parents, so it's, you know, until the whole debate about when we vaccinate kids and how young we'll vaccinate them is still, you know, it's still up for grabs. We still need to have more data about what's happening with the virus in younger people to see if that's the approach we want to take. But, you know, I think the reason that we're seeing it more in the younger people is just as Dr. Anderson was saying, is that that's the group that hasn't been immunized. And so they're the vulnerable group in our population. The vaccine does appear, there's data that the mRNA vaccines are still very effective against the Delta strain. I think AstraZeneca is a little less effective, which isn't licensed in the United States anyway. So I think that there's optimism that if we can convince people to get immunized, we can get on top of this variant. But it's also an illustration of the fact that the longer we do not achieve herd immunity through vaccine, you know, lower than optimal vaccine rates, the more vulnerable we are to other variants entering in, which perhaps won't be neutralized by the vaccine that we have, or that will be needing booster doses. So Delta strain is worrisome, but it's at least the vaccine is still a very effective tool to protect against it. For parents, I would just say the best thing they can do is get immunized themselves. Anybody who's eligible to vaccine, old enough to get it, should get it, to sort of cocoon protect the younger children from getting the Delta strain, because that's all we can really do, other than also teaching them, you know, hand washing and masking if they're able to.
We've had a question, Dr. Fairchalk, about travel with kids that are not vaccinated, and whether you have any advice for families thinking about summertime travel. About, would you go on an airplane with a kid who's not yet eligible for vaccine, for example? How to approach summertime with the kids? Yeah,
I mean, that's a tough one. I mean, people psychologically really want to travel and see friends and family that they haven't seen. And, you know, we are at a space where, you know, where rates have dropped significantly, although we are at that stubborn plateau, as Dr. Anderson mentioned. I'm lucky because my kids are older. I don't have to worry about that anymore. But I think that it's a calculated risk. I mean, parents need to realize that that their kids are still vulnerable, and that, you know, one thing that worries me is that now that the CDC has said that you don't need to wear a mask if you're vaccinated, there's no way to, there are a lot of people who aren't vaccinated who are just taking off the masks because they can. And in fact, I sort of feel like the people that are masked are in some ways more likely to be vaccinated, as we were just discussing. So I think if they are traveling, I would just try to do sensible things, like if possible, travel by car. If they're going on a plane, then try to have a direct flight, not several different stops along the way. If their children are old enough to mask, certainly keep them masked, keep the air vent on, that helps with the circulation. You know, try to keep your 6 feet of distance in the airport, and then plan itineraries or travel where you're not going to be mixing in large groups, especially indoors. Try to do things that are outside in smaller crowds.
Thank you. I saw a cartoon in the New York recently that said, I just pulled up my phone, says it's twins standing talking to someone, and they say, one of us always tells the truth, the other always lies. You can ask us each one question. How do you figure out if we're anti-maskers or vaccinated? That's really very clever. Okay, we've got some more questions. Dr. Anderson, can you expand on what you just said about young patients being just as sick as seniors were in the early days of the pandemic? And the questioner is saying, I think this would surprise some parents who are choosing to skip the vaccine for their children.
So in answering that question, I'm going to qualify the fact that Virginia Mason Franciscan Health we don't have an inpatient pediatric service. So the age groups that I'm talking about are those typically older than 18 and up. But remember, Cassie started off with some of the statistics. There are still deaths occurring throughout Washington State, and the hospitalizations are still occurring at a surprising rate. As I mentioned, our average age of patients being admitted for COVID-19 has dropped down to that between 20 and 35 year old age group. To be hospitalized, that means that the age of those becoming hospitalized, I mean, they didn't have the comorbidities that we talked about in the much more mature age groups of the over 65 groups that we started off with in this pandemic. So just by logic, as you start to look at the statistics, just realize that it's impacting a much younger age group that I'm sure those individuals didn't think that they could ever be caught by this virus and cause them to be hospitalized. I'll have to defer to the pediatricians on the call to say whether or not their patients they're admitting are just as sick as that what they may have seen or heard about in the adult medical surgical boards.
Dr. Fairchild, go ahead.
As a pediatric infectious disease stuff throughout the pandemic, no, I would say, I mean, it's still true that the kids that do get hospitalized are not as sick as adults. We've not had a death due to COVID yet in the under 18 age group at Mary Bridge Children's Hospital. We've had at least 35 cases now of the MIS-C, which is, a unique condition that we're seeing in kids post-COVID infection. And some of those kids have been very sick and in the ICU. Again, fortunately, none have died. So I think really what it is that, when coronavirus infects young people, they can become sick enough to come in the hospital that the rates of mortality are still, thank God, lower. I think we're just seeing a lower age range hospitalized because that it's like a statistic for a mathematical problem. I mean, that's the group that is the least immunized now compared to the older population, and the virus will find its host. And so, as more become infected, a certain percentage are going to be sick enough to need to be in the hospital. It's not that it's necessarily more virulent now in the younger populations, but in kids in particular, the pattern of disease has remained consistent throughout the pandemic. The ones that are hospitalized, some of them are sick and need, high flow oxygen or ICU care, but not nearly as sick as what you hear with adults.
Thank you. I think the sentence you just said about the virus will find its host is really worth pointing out. This virus continues to look for places to be and to mutate, and every single person that's infected is an opportunity for a mutation. And so that is another reason we really want the vaccine rates, is it protects us. The more people that get vaccinated, the more we are all protected from possible mutations as this virus looks for other places to grow and thrive. For any of you, are vaccines helping with long haul COVID symptoms? And what can you tell us about that?
Right now, that's an area of research that is desperately needed. Research is going on. We're actually going to start a study on long haulers in kids. But what exists right now is more anecdotal information based on surveys and like long hauler groups, or just observations from physicians who treat these patients. And what I've heard is that anywhere from 30 to 50% of patients with long haulers report that their symptoms are improved after they get the vaccination. A smaller percentage, like under 10%, say that their symptoms are worse after the vaccination. So that's anecdotal data, uncontrolled, unmodulated. So it's hard to say, is that true or not, but at least it's a little bit optimistic that potentially the vaccine could be helpful in that population and is unlikely to be harmful.
Anybody else have comments about that? Go ahead, Dr. Anderson.
Yeah, I'll just have to say that I have not received any feedback from our outpatient providers taking care of individuals with long haul symptoms. So I'm not prepared to judge whether or not the vaccine is helpful one way or another.
Thank you. Question from Keith Eldridge. This is a tricky question. It says, you talk about continuing to wear a mask after being vaccinated, but doesn't that send the wrong signal to people around you that you actually are unvaxxed and that's why you're masked up? Do you run the risk of getting glares from people who disapprove of people who choose to not get vaxxed? Unintended consequence. maybe I can handle it. I think I'd rather have a glare than a disease. So, I mean, I know it's weird. I think who knows what messages it sends, and I think uh, I'm willing to risk that because I want to be sure that I'm not I'm not a place that if the virus is looking for a place to be. I don't want it to be me or my family. Anybody else want to comment on that? I realize it's tricky. I mean, it's just the whole. I have family in other parts of the country where nobody wears a mask at all, and they think I'm nuts. So I think it's really variable.
So Cassie, I'm going to take my experience from my travels overseas and specifically into Asian countries, where prior to the pandemic, it was socially acceptable to wear masks when you had just a mild cold, because it displayed concern for others and you were wanting to protect them from contracting even a mild cold. So I think the opposite is actually true with wearing a mask after being vaccinated, because if you establish a cultural norm in which it says, I don't know whether you're sick or vaccinated or whatever, but a mask, to see someone in a mask is culturally acceptable, I think that's the best situation that we could have. And I indeed do wear my mask when I go out. I am vaccinated. If anyone were to ask me, why are you still wearing your mask? I'm going to say because I want to protect others. There is some breakthrough that occurs with the vaccine. Therefore, I am always concerned about being a vector for that virus. But also, I frequently wear my coat. Now it's 80 degrees out there. I'm not wearing a coat, but my coat does say Michael Anderson, MD, and they see me wearing a mask. And I know it's probably causing some conundrums as far as people thinking, well, he's a physician. Is he vaccinated or is he wearing a mask? If they were to ask and say, I'm vaccinated, I'm still wearing a mask.
Mm-hmm. So my daughter, one of my daughters is an engineer, and she does a lot of 3D printing. And so I think my video was disabled, but I was going to just show she actually made me, she actually made us pins that say vaccinated. And so you can just put that on your shirt and walk around. And so that way people see that and they see that you're masked. And if anything, they may ask me a question, why are you still wearing a mask? And then I can explain, why I would be doing that. So anyway, that's my way of doing it.
I also think an interesting thing that I noticed for myself, and I think a lot of the people noticed, is that we didn't get colds this winter. We didn't get all those diseases you normally get. I love not having a cold all winter. Like, I think, I may be someone that wears a mask on an airplane forever. All right, I think that is all the questions. Beth or Ryan, did you see any that I missed? I think I got them all. Anybody have any other questions? We're happy to have you unmute yourselves and ask a question or put it in the chat.
Hi, Cassie, it's Ryan Harris from Como Radio.
Hi, Ryan.
It's funny you mentioned colds, because I was just having a talk the other day with my mom, who's a retired nurse, surgical nurse, and she was talking about how it seems like there's more colds going around now because people are starting to take their masks off. Are we seeing that?
Colds don't usually come to the hospital, so we may not know. Did any of you have a sense about that, about whether colds are on the rise?
Well, in pediatrics, we had zero. RSV is our big virus in the winter, in addition to flu, and I've never seen anything like it. We had virtually no admissions for RSV, which usually fills up our wards in the wintertime. There have been, and it's very seasonal. Normally you see it November through March or April. There have been a few little cases of RSV cropping up now in the summer, which we don't normally see. So yeah, so I think maybe there is now a little bit more transmission because of people taking the masks back off.
And Cassie, I'll just have to say, I've only heard of anecdotal reports of people having upper respiratory infections, then going out to be tested for COVID-19 and coming back. I'm very happy that they weren't positive for COVID-19, but again, it's an indicator that other viruses are starting to spread as we start to become more active and, like we keep saying, and not wearing masks.
I think we all hope that one cultural change will be that people will be more reluctant. I say this about myself too. I have been to work plenty of times when I was sick, had a cough or cold or been out going to the grocery store. I hope that people will be a lot more cautious about that moving forward, including me. Okay, we do have a couple of other questions that have come through. What metric are we using to determine the severity of the outbreak now? It says we've been tracking cases and deaths, of course. Is that changing as vaccination rates go up? Are we pivoting now to hospitalization numbers or something else? For us, hospitalizations and ICU and ventilated rates have been the three things that we've looked at more. Actually, honestly, more than cases are the thing that tell us what hospitalizations may be coming to us in the next couple of weeks. So we watch that, but not as a measure of severity, but the things that we have always cared about the most is the hospitalization rate, ICU rate, ventilation rate. Anybody else want to comment on that?
That's what we're watching too, Cassie.
And those things are all included in the DOH data dashboard. You can see all those.
Absolutely.
Another question, we keep hearing about the rise in hospitalizations for younger COVID patients. Has that rate slowed with more of the population being vaccinated? It has slowed. So if you remember, oh boy, I can't keep track of time. About 2 months ago, I think we talked about that the rates were there were about 350 or so people hospitalized in the state, and then it went up. It started to go up again. We've said we were at the beginning of a fourth wave, and we really wanted people to get vaccinated and wear their masks and double down on their social distancing, and then the state responded, and so then we saw a decline. It had gotten up to about 600 people hospitalized, and then we saw a slow decline, and now it seems like it's, again, we're still waiting for all the Monday data to be reported, but I think it's going to be around that 350 rate again. But as Dr. Anderson noted, we keep kind of hitting, we can't get lower than that. We keep hitting the same plateau, and I think Dr. Fairchalk said it really well, which is that the virus looks for some place to land. It looks for a host. Kimberly, I wish I'd written down your sentence. It was better than that. And so it's still finding people to infect. And if people aren't vaccinated, they are vulnerable for infection. So we all, Dr. Anderson noted they've had 40 patients. They can't get below 40. I'm sure you all would have a party if you could get to 30 or 20 patients. And it just seems to be this number we can't get under. And so more people getting vaccinated is the key to getting lower than that number. Anybody want to comment about that?
I'm just going to reiterate that as I saw and charted out the surges that we had, when we looked at the surge that was the comparable to the initial March surge to the 1 year later March, there was at least a 15% drop in the peak of number of cases in that second surge. And I'll have to say, as a clinician, that has to be related to the number of individuals that have some form of immunity within the population to drop those numbers. So certainly, as we've heard already, vaccine immunity is considered more effective than just natural immunity, but having COVID-19 and having some immunity is going to impact those numbers. So yes, I think there's definite effect from vaccination.
And another question is that true statewide? We can't just seem to get below a certain rate of hospitalizations. It moves around the state. So certain parts of the state will have more cases than others, but that's the statewide number. And then there's another question of the 300 or so patients a day. Do we have a breakdown of the average ages? I don't, but I think that is on the state's data dashboard. And we could have a look. I don't have it at the tip of my fingers. We may actually be able to get that out of WA Health. So we'll have a look at that. Beth, could you check on that and get back to Drew if we do have that by age? Okay, thank you. Tracy, what's the current rate in Central Washington? Are you also plateauing and not being able to get below a stubborn level of cases?
No, well, we've actually been holding at anywhere between 1 and 5 a day. That's not counting the people that are out of isolation. So we have a number of long haulers that are still requiring hospitalization. That brings us up to about 10. Our overall positivity in Chelan and Douglas County is going down. It's now running anywhere between 80 to 90 per 100,000 people.
Thank you. Another question, Dr. Anderson just said vaccine immunity is considered more effective than natural immunity. Is that an industry-wide thought? Yes. I think that is a widely accepted, that it's stronger immunity and longer immunity. Anybody have any disagreement about that? So even if you've had COVID, go get vaccinated. Jessamine, I'm not sure I understand your question. I wonder if you could unmute yourself and ask it. The question is, what diseases may have been circulating that COVID may have masked in Washington State?
Yes, I apologize for not articulating that. I wanted to get it in before we close down. I've spoken to my primary physician who said, oh, we may not be recording the flu because people came in with symptoms, but we just tested them for COVID. Are there other concerns for diseases that we may have not been paying attention to because we were so concerned with COVID?
Dr. Anderson, you want to take that?
Sure, Cassie. I think one of the big advances from our manufacturers of the PCR for the COVID-19 test is that I'd say early in this year, we actually switched over to a quad test that had flu, had other viral upper respiratory infections. So we've been testing for the flu, same time we've been testing for the COVID-19 PCR, and we have just not seen any flu A or B in those tests. So I would not say that it's covering up. We just have not seen it.
I think that's
just add to that, like, again, as I mentioned, we had no RSV cases. So, whether if you go into your primary care provider and all they test for is coronavirus and maybe you had some other virus, yeah, sure, that's true. But we're not covering up or missing the lack of flu, RSV, other respiratory viruses, because you would always see hospitalizations every single year with those viruses, which we have testing for, and we just had none.
So those same measures that protect against COVID, we're protecting against those other diseases. I think this is not a disease circulating in Washington State, but we are concerned about people having put off healthcare, their other healthcare needs. If they've not gotten care for diabetes or needed a knee replacement or whatever their issue was, that they might have come sooner and delayed care because of just concerns about getting any kind of care where there's concerns that hospitals were overrun and couldn't take care of them. And I think that we are seeing an increased acuity or severity of other kinds of illnesses or health conditions because they haven't been as cared for as they should have been over the last year. That's not a circulating disease issue, but it is an illness issue.
I would just like to say I didn't mean to insinuate that anyone was not giving the proper care to anyone.
I didn't hear that.
Just so you know that.
Yes, no, I didn't hear that at all. I think it's a good question about do things get missed? Because that's something you all recall. We did a big campaign last spring about come get your care when you need care, because we were concerned that people weren't coming to get care, and so that their illness was going to get worse. So it's definitely worth raising about what else might be out there that we want to be sure people are taken care of. It's not only COVID that hospitals deal with. We deal with a ton of other things and are ready to do that. Want to treat people that have other illnesses. All right, I think that's all our questions. Any final comments from any of you, Dr. Fairchalk, Dr. Anderson? Tracy, thanks for being able to stay the whole time after all.
No problem, Cassie. Thank you for having me.
Yeah, thank you very much, Cassie, so that we could present the things that are most concerning to us. And,
yes.
Certain vaccination rates are right there at the center of our focus.
So if we leave you with any messages, it's you still got to wear your mask in healthcare settings and get vaccinated. Get your kids vaccinated. As I said, I thought about it long and hard with my boys who fall squarely in the category of concern and thought this is absolutely the right thing to do. So, I'm delighted that they're vaccinated. They're thrilled to be vaccinated. They got to go to a sleepover this past weekend with a bunch of unvaccinated friends, and just that's the first time in 18 months and had a blast. So it does open up. It opens up new avenues for these kids who've been really struggling with being locked down. All right, take care. We'll see you in a few weeks. Bye.